Hello, everyone, and welcome to the International Fabtalks. As usual, we are back again with yet another beautiful celebrity with a beautiful mind and who has contributed a lot with regard to mental health and improving your emotional baggages, which you carry all along and don't want to let go. So here we have somebody joining us all the way from Chennai. He is Dr. Ravi Samuel. Hello, sir, and welcome to the session.
Thank you for your invitation to join Feb Talk. My pleasure.
Thank you, sir. My friends, when someone accepts the invitation to the International Fab Talks, it's a day of joy for us because we get to learn a lot from our unsung heroes, from our celebrities, and of course, from people across the globe. So today we are going to learn a lot about important topics that are connected with psychology. And I'm eager to learn because I love learning and I would love you also to learn because learning makes you aware of all the issues around you. I'd like to introduce you in a more official way, sir. With your permission, I shall go ahead, sir.
Please.
My dear friends, as I earlier mentioned, we have today with us Dr. Ravi Samuel joining us from Chennai. He's a consultant psychotherapist. I repeat that again for all of us. Consultant psychotherapist and external faculty member. And also he's connected with the Board of Studies, the Psychology Department, and much more. I shall go much deeper into his profile. It's a very huge one. And like I keep wondering how people can acquire such a lot of knowledge in such a small time. Whereas most of us have been wasting time. You take me, I've been wasting all my time in just one profession, being an academician. But then there are people who don many hats, who have several feathers in their caps. So let us see how we are going to learn today from our special celebrity. I'll just go ahead and share Sir's profile. Sir is from Chennai, as earlier mentioned, and he has a clinic, the Psychotherapy Clinic, and it is in Kalainagar, Karuna Nadi Salai, Santoshapuram, Vengavasai, Chennai. And Sir's completed his education. He's completed his Bachelor of Arts, Economics from Loyola College, Chennai, India. Again, he's completed his Master's, Social Work, Loyola College, Chennai, India. Postgraduate certificate in Applied Research Methodology, Thames Valley University, London, UK. Master of Philosophy, MPhil, Social Work, Loyola College, Chennai, India. Doctorate in Medical and Psychiatric Social Work, Madras University, Chennai. The current position that our celebrity holds now, that is Dr. Ravi Samuel, it's a consultant psychotherapist, 19 plus years in India and 1 year in UK with clinical experience among people who suffer from emotional baggages or emotional wounds, behavioral and psychiatric problems as well. Sir focuses and has expertise in dealing with such cases. And he's also an external faculty, as I earlier mentioned. He visits the Institute for Psychotherapy and Management Sciences, Old Sathya Studio, Adayar, Chennai, Tamil Nadu. Board of Studies member, Psychology Department, Periyar University, Salem, which I missed out at the start. I'm mentioning it now. Again, Board of Studies member, the Psychological Department, SRM, Psychology Department, Katangalathur, if I get that right, and associate member of the Indian Psychiatric Society. Now, professionally, sir has a very big list. Now, that's really wonderful. It's very impressive. I'll just share a little and we'll keep all a secret to get it out from Sir directly. Sir has been trained in cognitive behavior therapy by Mr. Allan Davidson, cognitive behavior therapist at the Department of Clinical Neurology, Institute of Neurology, National Hospital for Neurology and Neurosurgery, Queen Square, London, WC1N3BG. Sir has also attended different courses, and one of them to mention here is a short course on dementia. I'm very much interested in getting to know more about dementia because it affects most of the people when they cross a certain age limit. Let's get more. Let's get my doubt in my head cleared. So that I'm going to ask sir about it. And I'm sure you also interested, my dear friends. And neuropsychiatry in National Hospital, Institute of Neurology and Neurosurgery again, Queen Square, London. Basic clinical audit course in Northwick Park and St. Mark's, NHS Trust, London. Indo-UK workshop on epilepsy at the ITC Park, Sheraton, Chennai, India. Basic research methodology at the International Epidemiology Conference, Malaysia. If I got that right, if I mispronounce anything, forgive me, friends. I will learn. And you too, don't feel ashamed if you make a mistake. It's always a learning chance. We correct our errors and rise higher. An advanced research methodology course conducted by King's College London at National Neuroscience Institute, Singapore. Sir has a vast experience in different countries and India as well. He has presented several papers and has conducted several workshops, to mention a few. Cognitive behavior therapy for sexual dysfunctioning in the 26th National Conference in Sexology held in Chennai Savera Hotel, and as well stress management for the Hindu in Chennai, that was in September 2010. Cognitive behavior therapy for psychologists and counselors for Chennai Counselors Foundation at Institute of Mental Health, Chennai. Cognitive rehabilitation for patients with dementia, Indian Psychiatric Society, West Zone, CME. And Sir has now such an illustrious list. If I go on sharing Sir's list, it will take another 10 minutes. Now, I'm just going to put a full stop to this. Yeah, and I'd like to mention this. Sir has also attended several TV shows. To mention one here is Maname, if I'm getting that right, Raj TV channel, and many others as well. So now we'll just stop here for a minute and dive into the session, get to know more. Psychology is one main domain where I'd love to get a lot of knowledge, and not only keep it with me, I'd love to share it with everyone, because the need of the hour is not only physical health, but also your mental and emotional well-being. Hello, sir, and welcome to the session. Yes, thank you so much for sharing your time with us. Being a busy person, you've taken out time for the International Fabtalks. Rumbo Nandri, sir.
You're most welcome. My pleasure.
Yes, sir. I've been sharing your profile and I've just shared a little. There's much more to you. So we'd like to ask it directly from you. Who is the real Ravi Samuel?
Well, the real Ravi Samuel has no identity at all. The thing I love the most is to just be myself, not as a psychotherapist, not as Dr. Ravi Samuel and all that. That is the state that I enjoy the most, being my own self without any identity, as just as another human being on this planet. Because my professional identity is very complex. As you very beautifully said, mental health and emotional health are very important. And over the last 2 decades, those are the casualties of all the changes that are happening around the world. The IT industry brought a lot of opportunities, but compromised on basic things like sleep wake cycle. And that leads to circadian rhythm disturbances, and that leads to lots of mental health issues. Nowadays, marriage is at a very big problem area, meaning at least 6 out of 10 marriages get into marital disharmony, and at least 4 out of 10 file for divorce, sometimes as early as 2 weeks. And these are not arranged marriages, these are love marriages where people knew each other, got married, and found that they can't live together. Children are at high risk for mental health issues because so much pressure on the children to perform both academically and in extracurricular, to sing, to participate in television shows, to do well in sports. Elderly people are at risk. The rate of depression is about 40% among elders. And as you also raised interest, this area of dementia, the prevalence of dementia is about 4 to 6%. So elderly, as they grow older, sometimes have plaques in the brain, which leads to memory loss, and then a slow, gradual deterioration in their functioning. So all put together, it's a very challenging, very dynamic field, and more and more professionals are required.
Yes, sir. Thank you, sir, for sharing that. Thank you very much. The question in my head is, why did you enter into the domain of psychology? What made you come into this beautiful zone?
That's a very good question because when I was doing my post graduation, my question was, what do I do next? Where do I go and work? So when I was looking at a place to park my career, I wanted a place where there was nobody or very few people. And I found that psychotherapy is an area which was very, very less attended to. When people had mental health problems, they were given medication and little counseling, and that's all. Whereas many people require psychotherapy. So I found that there weren't many psychotherapists in Tamil Nadu, Chennai. So I kind of gravitated towards it.
Yes, sir. That's really nice. Thank you very much for sharing that, sir. Now, we'd like to get a clarity as to who is a psychotherapist and what role does he play in the lives of people or the clients.
Sure. See, mental health is a phenomenon that is enjoyed by everyone. But when a person loses the mental health, they become mentally ill. Mental illness is treated by a team, always by a team. There is a psychiatrist who is basically from a medicine background. They prescribe medicines like antidepressants, anxiolytics, antipsychotics. Then comes the psychologist who does extensive assessment on the person's intelligence, personality, psychopathology, problem areas. Then comes the psychotherapist who does a lot of counseling and psychotherapy. The difference between counseling and psychotherapy, counseling is like giving medicines to the patient, and psychotherapy is like performing a surgery where you get into the minds of people and do lots of corrections in their beliefs, in their attitudes, in their thought processes, in their emotional reasoning, in their whole gambit of how their mind functions. Then comes the psychiatric nurse who monitors patients' medical complaints, reminds them of medical consultation. So it's a beautiful teamwork, whether we work in a hospital or even in private practice. Though there is no formal setup, we all coordinate with each other and treat people. So that's how the whole team functions.
Yes, sir. Thank you very much, sir, for the clarity that you shared with us today. Thank you very much. So, one important area which I'd like to discuss, because one of my aunt, she was suffering from dementia. Now, I want to know the difference between Alzheimer's and dementia. Are they one and the same, or is there a close relationship between both of them?
Right. See, dementia is a common name. Alzheimer's is a very specific name. Under the umbrella of dementia, there can be both treatable dementias and the progressive dementias. Alzheimer's is one such progressive dementia. There is no known treatment as of date. Ronald Reagan, ex-president of United States, had this, and he made a very beautiful statement when he could cognitively process his condition. He said, "I begin a journey to the sunset of my life." So that's how there is a slow progression of the illness. But in treatable dementias, if they have a nutritional deficiency or any kind of tumor that is inhibiting the cognitive functions, then once the tumor is removed, patient is back to normal. So not all dementias are progressive.
Yes. So, how now see in the layman's language, they will not understand dementia, Alzheimer's. What are the signs and symptoms? Like, how does one identify that our family member is suffering from this ailment called as dementia or
Right.
Alzheimer's?
See, all of us go through memory loss. If a elderly person is emotionally affected, they will first experience severe memory loss, And it is normal for people as we grow older to experience certain amount of memory loss, which we call as benign memory loss. It is normal, nothing to be worried about. It is just part of aging. Don't be concerned about it at all. Develop some sort of aid to support your memory, like for example carry a smartphone with reminders in it. Your problem is solved. But in a condition like dementia, it starts with, did I have my breakfast today? Where did I keep my keys? Where is my watch? And then after about 6 months or so, the memory loss increases to the extent of saying, where am I? Is this my house? This is not my house. Kind of doubt starts coming. And they will start forgetting people. When they meet someone whom they know very well, they may not get their names. So, when memory loss is very progressive and when it affects the person's functioning, that's when we need to go and meet a neurologist and completely evaluate for dementia. Normally, family members would think he's very forgetful. Why is he like this? He's not giving attention. But over a period of 6 months, you will notice there is a gradual increase. So that's when people have to approach a doctor. Not only memory loss, in concentration, in calculation, in speech, inability to find the right words when they speak, inability to express themselves well. They may talk three sentences about one subject and then completely forget that they were talking about that subject and change to another subject. And as the illness progresses, they may forget what is where in the house, where the bathroom is, where the kitchen is. So it will create a lot of confusion in their minds. So these are the early symptoms.
Thank you very much, sir. There's so much to dive into this beautiful topic and create awareness in our families, in the society as well, and across the globe. In a certain case, I've seen like a mother-in-law and daughter-in-law had this. The daughter-in-law thought that the mother-in-law was faking all of it and creating, some type of confusion. But the truth was, all these symptoms which you explained, they were all genuine ones. And she got to know about it later on, the daughter-in-law, that my mother-in-law did not fake all of this. It was a progressive case of dementia. And then she felt very guilty. Of course, by then she had lost her mother-in-law. Yeah. The mother-in-law happened to have a stroke and led to her demise. So this is one event which has occurred. So that really makes me nostalgic. And when I met this person, this is what she shared. So now let's come down to when you are dealing with different kinds of patients or different, we can't call them as patients, we'll call them as clients. When you meet different clients who come to you for treatment or for therapy, what type of challenges do you face?
Right. See, sometimes their lives are resonating with yours or your past experiences. Sometimes you know that they are in an abusive relationship, but you can't directly tell them that they are in an abusive relationship. Sometimes they are going in the wrong direction, taking all bad decisions. Sometimes it is more emotional when patients, when they come, they are brought by the parents. And I've had instances where the mother telling me, Doctor, you please take care of my son. I will not be coming next time. Why would you not come next time? She will say something like, doctors have diagnosed me to have cancer and my life expectancy is only a few months. So those are the moments which will completely shake me up. And on the other hand, there are very beautiful things happening. There was a girl whom I like to mention. She was in her plus two. She was in love with her classmate. She came and asked me to support her in this. because her family was dead against her, particularly the relationship. I told her, you first focus on your studies, qualify yourself, and get into a job. Then you decide about these things. That will give you a better platform. And that's all. I never got to see her again. After many years, an young girl called me and she said, I want to meet you, doctor. So I gave an appointment, and she said, Doctor, I'm the girl whom you asked me to go and focus on studies. I did my engineering, I went to IIM, and I'm in a very good job. I want to tell you that I don't want to marry my classmate because his life and my life are so different. I don't think we can get together. I'm going ahead with my profession. So I was very touched that this girl remembered that and shaped her life based on my advice. So there are touching moments like that. Your mic is muted, madam.
Thank you, Sai. I'll always do that. And most of the time, I'm reminded you are on mute. Yes. Thank you very much for sharing that. Thank you. Thank you for sharing your real experiences with us, sir. Now, I have a question. Do you think India is open to getting treated with regard to mental health, illness, and emotional well-being? People don't want to come forward. Physical ailment, they will rush and jump and run immediately to the hospital. Yes, even if they sneeze, they're in the hospital premises. But if there's a lot of emotional pain going on, emotional abuse going on, psychological abuse going on, psychological turmoil going on, they will not come out in the open, fearing the stigma that is attached to the Indian society with
Very
regard to mental.
true. Very true. See, one thing very beautiful about India is there are a lot of therapeutic factors in the family itself, among family friends. People counsel you, people advise you, people listen to you, people give you time and energy. Beyond that, you may need professional help. And interestingly, over the last 10 years, things have changed drastically. Earlier, my clientele would be 60% of those with mental problems and 40% of those from the society having psychological issues. Now it is completely ulta. I get about 60% of people with psychological problems and 40% of those with mental health issues. So there is definitely an opening of minds to reach out. This I attribute to the functional requirements. Everybody today is required to be very functional. If they are not functional for about 2 weeks, then something very drastic happens in their lives. So there is a pressure to be functional. So people are reaching out earlier. Even if they have anxiety problems, I notice people come within about 2 weeks of anxiety problems, and this involves all age groups.
Yes, that's really nice. And I'm sure India is really changing and improving on all fronts, including giving importance to mental health.
Mental health.
Yes. So the question here arises, like, what age group, as you mentioned, all age groups. Now, when you take up a client, should they come with somebody else or they could come alone to approach you for a session?
Sometimes they come with a family member, but few people choose to do this alone. So we welcome both parties. We don't insist because they are not very comfortable about family members getting to know about their sexuality problems. Imagine if they are a gay or a lesbian sort of relationship. They don't want the family to get involved. Sometimes, even in a marriage, one of them would come seeking help, not bringing their partner because they don't want the family to be involved. But we encourage both of them. Sometimes, due to the nature of the illness, we need an informant. particularly if they have false belief that people are kind of chasing them, people are spying on them. It may be true or it may just be a false belief. So under those conditions we need a family member to endorse whether it's an abnormal process or it is a normal process which the patient is reflecting on.
Thank you for that clarity. It's a very big one which we needed today. Thank you for that clarity. It's really very uh, I should say thanks to you once again because I'm short of words.
You're
Yeah,
welcome.
because you said, like, they are welcome. Even if they are coming alone, they don't want their family members to know certain issues about their mental health and that thought process. They could come alone. But at the same time, you also mentioned that, yes, we require an informant in case of the other case where you find that something's wrong, not okay, or they are like obsessed with certain thoughts. Let's tell you.
Correct.
So you were even into this beauty. You are into this beautiful field called as connected with epilepsy. You have taken a course up there. What is all that about, and why does it happen? Who are prone to these epileptic, you know, seizures?
Right. See, epilepsy affects the brain function. That's where I come in. Untreated epilepsy or epilepsy which cannot be controlled leads to personality changes. So, for both these, I get involved to help the clients to lead a near normal life and to enhance their mental faculties like memory loss or loss of concentration or attention or language difficulties, calculation problems. Epilepsy is a very wide phenomena where the electrical activity in the brain has a storm like activity which leads to these seizures. This can affect any age group, particularly post injury. Anyone can have seizures. That's why when someone has a head injury, they should be immediately taken to a hospital, administered proper care, because they may develop seizures and that can lead to brain damage. So seizures is a condition which normally uh, treated, sometimes not controlled.
Thank you, doctor. Thank you very much for sharing that. Now we'll dive away from the professional field and come a little more to get to know you and then come back to the professional space because you've given out a lot of important information. But before we go into the personal space and personal zone, uh, I happened to meet a person who shared an experience with me that she was undergoing some turmoil at home with her family, especially her spouse, and she happened to meet a psychologist, and it was a genuine problem. She had nobody with her. She went alone to meet the psychologist. Just within 5 to 10 minutes, the psychologist called in a psychiatrist to give her some medication. And she immediately got up from there and came up. So sometimes, for a commercial purpose, some people forcefully give medication, certain professionals. So I would like you to share your thoughts on this. And she's very fine today. She's very happy today. So without medication, she just wanted someone to counsel her. But here was something quite different, which she was quite aware, and she walked out of it. And of course, they asked her to bring an informant as well, a person with her.
Right. Right. See, this is where the training becomes very important. A training which is very standardized. For example, if you are not trained well, you may not know exactly how to respond in a situation. From what you're saying, it looks like the therapist panicked and called for a psychiatrist, and the psychiatrist over enthusiastically prescribed medication. These things don't happen in a good training setup. The best thing would be to talk gently to that person, ask them to come back with a relative, and then have a psychiatric consultation, sometimes we can shock the patient out of their wits by saying certain things, by doing certain things. This is where the training is very, very important. I'm thankful to my training in UK, because very intense, very methodical training, which teaches you how to respond in a situation appropriately, particularly if you're dealing with someone who is not in their normal senses, who is little disturbed. So I feel sorry for this girl, lady, to have experienced this. You go for help and you get a shock of your life at that place is the most unfortunate thing, isn't it?
Yes, thank you, sir, for sharing that. As you've mentioned very clearly, that training does matter if you're trained in the right way and you know how to use the training process in the right way when you start up your profession. That's really good. Yeah. So sometimes what I felt when this client was sharing with me, when she was sharing with me, this person, I felt there was a lot of commercial thing attached to it. Or I don't know, I can't express that in the right way. If I could put it in the right way, unnecessarily medication was being given to that person. Only she required either counseling or maybe a talk session or maybe just a normal, you know, a conversation to get her out of the pain. So then, and they gave her a long list. That's what she said, and so that was. So we are happy that she's fine in her space now. Thank you,
I,
doctor. You say yes. You'd like to share something? I interrupted you.
I completely get your point, because when I started my clinic, there were a few doctors who invited me to their clinic and started this cover culture. They said, if we refer you a patient, you pay us back this amount of money. On day one, I decided I will not get into it. And I said, sorry, doctor, I will not. I don't want to get into this kind of a practice. Whoever comes to me, I'll see them. I don't want to engage in this commercial setup. So definitely there is a commercial element to it in medical practice, and sometimes it is very badly used. See, sometimes patients are helpless. They are coming in distress, and that's a point at which one can easily exploit them. So so it's it's definitely possible there is this commercial angle to our practice.
Thank you, doctor, for being very honest on this and creating awareness amongst the public that yes, you have to stay safe, meet the right kind of people or the right kind of professionals to get treated or to seek therapy. And you
Correct.
could connect with Dr. Ravi Samuel too. He's one of the honest psychotherapists available in Chennai and Pan India as well. Of course, now it's online. Anybody across the globe could connect with Sir. So we'll come down to the personal space.
Sure.
Apart from being busy as a professional, do you ever get time to read books, novels, fiction,
Early
non-fiction?
morning, I'm a gardener,
Oh, great.
and then I become a psychotherapist. Then lunch and post lunch, I'm a very family uh, oriented person, and then I get time to catch up with my reading and to look at the mails and all that. Then again in the evening I practice, and then in the night time for some shows, TV shows, some relaxation again with the family. So I wear many hats that way.
Yeah, so your day is really planned very well. You've scheduled it well. And I love this. Early morning, I give myself to gardening. Now, I'd like to ask you, sir, gardening is very healing, therapeutic, and it has a good, feeling when we connect with nature, with flowers, when you even see a little bloom, like a small bud or a little leaf or a twig or maybe a
Absolutely.
twine, that gives immense pleasure. So, what I would like you to suggest this even to the others, all of us, how one could heal themselves getting connected to this beautiful work called as gardening or a hobby called as gardening or spending time with nature.
See, it's a very beautiful process, because number one, you are completely in tune with nature, and you're guided by the forces of nature. You're not exactly uh, controlling all the factors, because the weather is not under your control, the growth of the plant is not under your control. Sometimes you fondly grow a plant and suddenly it's kind of dying out. It creates a lot of sadness in you, so there are lots of emotions also involved in this. But more than anything, it gives you a purpose to get up and get out of the house and do something. That's very important, I think, because one of the problems is getting out of bed. For many people, they wake up, but what is the purpose? What do I do now is a very big question. And second is engaging in anything that is constructive, which has growth. When you see a vegetable, you're so excited. You take a picture, put it on Facebook or WhatsApp, others are congratulating you. You're so excited to see the fruits of your labor, literally. So it is very rewarding in many ways. And also you need to look at the water availability, how much water. So a lot of calculations going on and planning going on. I buy a lot of seeds and grow it from the seed level, so it gives a lot of pleasure to early morning go and see what is the growth today. And I also have a medical unit for plants where the sick plants are being taken care, like ICU. It's all fun way of doing things. Of course, people laugh at certain things that I do, but it gives a lot of pleasure and keeps you occupied, basically. And there is definitely a sense of purpose. And you have something to show to friends. Instead of sending you the picture of your face, send the picture of the fruit. They are more happier.
Very true, sir. I really like this. And the one that you shared just now is you have a special space for the sick plants to take care of them. That really makes me happy. And friends, if you have some plants like that, just segregate them, give them extra care. And once they are blooming, bring them back again. That's really nice,
Correct.
and place them together. Wonderful, sir. That's really nice. And observing the small shoot, that gives immense joy. And maybe the previous night, you'll be imagining, which plant is really going to give me a small bud or a bloom. That's all in our mind. And when we do gardening, we are in the present, observing. So instead of being in the past or future, you have a lot of healing taking place because you're connected in the present, my friends. Beautiful, sir. And carry on with it, with this beautiful gardening process which you're continuing. Let me ask you, you have vegetables, fruits, and flowers in your garden,
That's right.
all of the three?
Sorry?
Ornamental plants as well?
Yes, yes.
If I may ask you, how many pots you have? Like how many potted plants?
Probably about 50, 60.
Yeah, that's really nice. Would love to have
That's
that great feeling of having all the potted plants around us, or maybe trees around us. That's
and
really great.
and it consumes a lot of time. Unless you're passionate about it, it becomes very burdening. And the second thing is, if you're in a place where water scarcity is there, it becomes a problem. Otherwise, it's such a pleasure.
Very true, sir. Very true. Thank you very much. Yes, if you have lots of water, then you can really have lots of plants and take care of them.
Right. And the other thing is going and sitting in the garden area with all the greeneries around, with a cup of coffee, a book, or a newspaper, takes you to a completely different world, and you're also inhaling fresh oxygen. So it's not really an activity, it is also enriching lives. People like to come and sit in the garden, they like to have a chat there, so it's a very rewarding experience in many ways.
Very true, sir. And at the same time, you will have certain uninvited guests as well. Birds, butterflies, little insects.
Lots of insects.
Yes. Observing them too gives us pleasure, and it's very therapeutic for us to see how
Correct.
they live, how they overcome the challenges. The little insects, you may take an ant or you may take a spider, or any other insect that is in your garden, like you could observe that. So that's really nice. You've taken me to the garden, and because I too love gardening, so I went deep
Oh,
into that. I dived
I
into
s-
that with you. So How would you want people to remember you? How they should remember Dr. Ravi Sandhu? And why?
As a good human being, I suppose, because though I do a lot of professional work and all that, beyond that, the human element is very important, madam. Sometimes patients come and tell me that they cannot afford. So I tell them, you fix the fee then. So they get very surprised. Here is a doctor who says, you fix the fee. I don't know your circumstances, so you fix the fee, I'll treat you. Because money is not everything. You see, money comes and goes, and we cannot anchor our lives on money. The human element is very, very important. And the second thing is, reaching out to people is very important. When people have lost hopes, I once treated a person who had 38 arrears in his engineering. I helped him with lots of brain functioning exercises, study skills exercises, and then he cleared his engineering. That was great joy. What became a dream for him became a reality because of my work. So there are moments which is very uplifting, and it takes you completely overwhelmed. So those are the moments I enjoy very much, and that's what I like people to remember me for.
Yes, like giving wings to them to fly.
Correct.
Yes, when that dream was transformed into reality and that you were the reason for it, when you were the person behind his success or connected him to the success path, it's like giving wings and freedom for him to fly on his own. That's really nice. We should all try to do that.
I normally don't think that I'm the reason. I always keep saying, I carry the torch, but I'm not the light. I facilitate the process. I don't take much credit for it because, as I said, I carry the torch. I'm not the light.
All humble people say this. You're very down to earth, very humble. Yes. So, apart from all the hard work you have been doing on the professional space and normal, do you ever get, you said you've spent family time and gardening and all of that. Movies are also a part of your life.
Absolutely, but present days I find when I go to the movies, the sound levels are very high, and my watch keeps giving me the signal that the decibels are very high and it's very harmful. So I stopped going to the theater. Mostly on OTT, I watch them. So yes, I enjoy watching movies, particularly if they don't have much of violence.
Yes, sir. So I'd like to ask you, do you think the producers, the film directors, are producing good films with regard to mental health awareness, overcoming emotional challenges, or is it just only commercial? Are they good movies? And if yes, you watched a good movie with connection to the psychological arena, would you like to mention that movie? The name of the movie?
Definitely, yes. There are some movies which reflects on the mental health of the people. Particularly a movie by name The Great Gatsby, played by Leonardo DiCaprio. He pursues his ex-girlfriend who is married, and finds that she has become very loyal to her husband and loses out on the relationship. This is an issue that many people face because we have lots of get-togethers in the schools, colleges, when they meet their ex, and when they have their WhatsApp where they can secretly message, then the relationship again blossoms, and it kind of gets physical many a times. And then there is a lot of confusion in the families. Then they break up. Then they are left with lots of emotional problems, lots of difficulties. So there are movies which very beautifully portrays that such relationships don't work and it's better not to pursue. So definitely there are lots of messages, but movie makers are very commercially oriented. They don't specifically focus on this, but there are movies which are mindful of this.
Yes, sir. Thank you, sir, for your input. Thank you very much. You've mentioned even the name of a movie. You've explained that to you, given us, the entire picture just in a few lines. You put that very well. Thank you very much. Apart from movies, do you get time to take off a holiday and go to a nice place and have a lovely vacation with family and friends?
Absolutely. I love traveling, and thankfully, my wife loves traveling, and we both travel a lot and have a very relaxing time wherever we go, whether it is Bangalore or Ooty or even outside places like Israel. Um, we enjoy traveling very much,
Even solo traveling appeals to you?
very much.
Your favorite
But
destination?
London.
Oh, great.
Because I studied there, I think. I've been going there. I think after my studies, I went there about 12 times. So it's a place where I enjoy being my own self.
Yes, that's really nice. To take off some time for yourself, go on a solo trip, learn more, come back rejuvenated, and upgrade your skills. By meeting new people, by observing people, we start becoming stronger. If we are in the four walls of our own home, we don't learn much. So when we travel, when we move out, we start observing people. So just that too could bring a change in us. Yes.
Very true, very true. I want to narrate a small incident here, if I may.
Yes, please.
There was massive rains in Chennai, due to which many trees fell during Varadapuyal 2015. My wife had given me lunch to eat, and I went to the clinic and I found that the clinic was in no condition to work. So I went and sat in a park, and there I saw an young boy sitting. So I asked him, "Did you have anything to eat?" He said, "No, sir." I said, "I have some food. You please eat." He was very hesitant. He said, "No, sir, it's fine. I'll manage." I said, "There are no hotels here. You please eat what is available. It so happens I am here." And I gave him food. He ate the food and he took about 13 medicines. I had a shock of my life. I asked him, "Why are you taking so many?" He said, "I had kidney transplant. Morning I need to eat. There was no place to go and eat. So I was wondering what to do, and here you're offering me food." It's very, very important to reach out to people who are less fortunate, who are in difficult circumstances, who are in a condition, who need help. They may not ask for help. So that is very vital and something to be done by everyone, I think.
Thank you for sharing that lovely incident, sir. The experience that you had, that anecdote, a beautiful one. And I could really imagine the little boy sitting beside you and having his sharing the lunch with you. I visualized that immediately, the way you explained it so crisply and so well. Yes. And he might have seen God in you when you did that. And yes, you very rightly mentioned many people don't ask for help, they hesitate to ask for help. But if you see somebody who really requires help, go up to them and lend a helping hand. That's the message we get from
Correct.
sir with regard to this incident. Yes, sir. So, what is it that you love about yourself? What is it that you admire in your own self?
I i i think I love the simplicity that I enjoy. I love things not going into my head irrespective of whatever I do. About few years ago, I did a very big training program for the police department. I trained 1,25,000 police personnel in Tamil Nadu and in Delhi. What I liked was it never got into my head that I did such a massive program. Oh, Sam, you're one of the, nothing like that. It's doing the task that is assigned and then carrying on as though nothing happened is very important to me.
Yes, as I earlier mentioned, you're very down to earth and very polite. And thanks for accepting the invitation to the International Fab Talks, because I have seen people who have achieved nothing, and when we have given them the invitation, they have so much of ego.
I
But
see.
people who have